Hi, my name is Ryan Nichols, and I work at the Institute for Women, Peace and Security in the Edmund A. Walsh School of Foreign Service at Georgetown University. Today I have the pleasure of speaking with Dr. Hawa Abdi, who is a Somali physician and human rights advocate. Dr. Abdi is trained as a gynecologist as well as a lawyer and is the founder of the Dr. Hawa Abdi Foundation. This foundation provides shelter, housing, and nutrition for Somalis who are internally displaced due to conflict. In 2012, this organization housed over 90,000 individuals. Dr. Abdi, thank you very much for taking the time to speak with me today.
I'm from Somalia. I have finished my study in the Soviet Union. I was working as a physician, especially OBGY, gynecology and obstetrician. The job was going smoothly, but in 1990, Somali government collapsed. Before that government collapsed, there was already government not stable. People were suffering. There was, no law and order well kept. So many people fled from Mogadishu, which is our capital, and we, with my husband, we moved from Mogadishu to nearby 21 kilometers from Mogadishu, where I had before a farmland of my family. I always trying to help the women during in labor or when women is sick and children. In my family farmland, I built one room of clinic, one room. It was 1983 that time. We moved it from Mogadishu to our land. Then after government collapsed in 90, many of my friends, they fled from the capital, and many people come in our land. We welcomed them. First was almost about 460 families. Then bit by bit it increased, and it became 1,500 families. People that time were suffering, killing each other. Our problem was tribal problems. So they were at night, sometimes they were attacking families, sleeping, killing, wounded people were coming to me, mentally not fit because his family or her family were killed in front of him without any reason. And the person also himself wounded. There was no government, no law and order, but I was trying myself to say something to those people who was really suffering so much. And I was treating the wounded people. I remained there for so long time, for 22 years till now. People were dying for starvation, for gunshots, for frustration and depression, mentally unfit. People were dying on the streets. It was 1991, 92. Per day we were burying in our camp about 50 bodies because of gunshot, car accident, starvation. There was not a good material for health to treat. I was alone at that time. My daughters were still young. All the doctors, all the people who had something, they fled from Somalia. Really, it was a very difficult time for me. After little bit 1992 came a coalition, which is 24 states, and called it Operation Restore Hope. Before we were not having food, port was closed, and airport was closed, but after Operation Restore Hope came, many military of different countries come to us. They tried to help us, but still people were dying. What has happened is, already began that time, warlords based by big clans, well-equipped weapons. They are economically enough. 2007 became Islamic court. And Islamic court, after Islamic court, they fight with the warlords were weakened. Then Ethiopian army and the other African armies come to us. Then all Mogadishu people fled from outside. In my place, I was living Afgoye, were called Afgoye corridor. In only Afgoye corridor fled 400,000 people. And in my camp became 15,000 families, which is 90,000 people. It was very difficult to manage in middle of that place where there is no law and order. But when they were coming, because they were killing each other by clan, and after where the family's head became frustrated and it upgraded, goes up, violence, domiciliary violence, what?
Violence? It's a violence.
Violence of the family. Men became
Domestic violence.
Domestic violence, yes. Men began to beat every man, beating his wife, and after they come in my camp, I was afraid that they began fighting by clan, by tribal fighting. We organized 2 rules. No clan division in this camp. No man can beat his wife. We emptied 2 rooms, one for men, one for women, female. Then everyone who broke our rule, we made a committee, we were getting him and putting into that room we called jail. We wanted the environment was calm and safe, and we succeeded.
Well, it sounds like a very, very trying 20 years, but it sounds like you've also been able to do some very meaningful work and do things that are very important. Your foundation and your village are, I think, great examples of that, and so it's encouraging to hear you tell your story a bit. One of the things I'd like to hear a little bit more about is in the work that you've done in your village and setting up these jails and all your innovative solutions, how have you encouraged women to be leaders in, like yourself or like your daughters in the same actions that you were doing?
Yes, because that committee was having a meeting. There is a woman, youth, and elder man. So women was member of the decision makers in the camp, inside the camp.
That's fascinating. And their presence on the committee was respected, and they were able to have a strong impact. And
yes, they were respected. In our community, the women is the backbone of the families. Because these 20 years, women was carrying the family. Men was talking or fighting. Women was working, feeding their children.
So in addition to these committees, during the time in conflict, like you were saying, women held the family together and held society together.
Yeah.
What other aspects of either the healthcare that you provide, or the feeding services that you provide, or the shelter services that you provide, how are women involved in coordinating that or implementing that in their communities?
How many percentage your employee are women or female, or how many?
We have a school for the kids. How many teachers? How many women?
11.
11. How many we have?
We have 50-50 in the school.
In the
50
school.
male and 50
Wow.
Women
teachers.
and teachers, male teacher and female teachers, they are the same. Just we are trying to make them equal.
Equal.
But the hospital more female.
Yeah,
You
the
got
hospital,
nurses and the midwives.
nurses, auxiliary, cleaners, all they are women.
That's encouraging.
Then we have made a women educational center where we are educating women and teaching handcraft, cooking, and also the education. Some Somali women, they do not pass any school. So
Literacy.
Illiteracy.
Literacy
Yeah.
classes. We're teaching math and Somali language literacy. How to read and write.
Yes, we were teaching them, and still there is that school, but only in our camp now.
Only in your camp.
Mhm.
I guess another question I have, and maybe this is to you, Deco, as well. It seems that as a physician, you have a certain standing in society, and you're able to have more authority, greater weight to what you say than you would if you were in another profession. And how have you been able to, or you, Deco, been able to translate the authority you have as a medical professional into the work that you do in other areas, so that you're able to advocate better for women and children in Somalia, or for internally displaced people?
I'll try to translate for her. dhakhtarka qaali ku yidhaahay wadanka qofku markuu dhakhtar iyo physician waa ka sareeya dadka kale marka awoodeeda oo dhakhtarnimada say u isticmaasha saa dadka uu horumar u gaarsiisid khaasatan dumarka.
That is true. All over the world, doctor, when you wear a white shirt, people are looking you little bit high. Even in my country, it's like that. So everyone, sometimes they need you, and I fulfill their needs. What I can do. If you today treat assisting labor is wives, children, adults, they will respect you. And I was donating my knowledge, not free, because our knowledge, me and my 2 daughters and all my hospital, healthcare is free, education is free, we have wells, water is free, land they live free. We have some guards. Even we are trying to protect the girls, the women. Sometimes there is a delinquent which is not violent man who wants to rape the woman, to steal something. We are protecting that will not happen in our country. So we were a small state, having our president,
Which is you?
yes, having our security, having our committee of the court, which was elder and including women and youth. They were deciding if any case. We were working as a common law.
You help women as in your capacity in every way.
Yeah.
using your profession, using your power, using your land.
Yeah,
It's very comprehensive work.
yeah,
And it's very encouraging work.
yeah. But I say that every woman in this world can do what I have done. Any success I have achieved, I learned someone wiser than me. It was my first, it was my grandmother who teaches me how to forgive, how to work.
I have one more question for you.
Yeah.
Given all that you've seen and all of the work that you've done,
Mm.
what do the words peace and security mean to you? How would you best define them for Somalia, for the work that you do?
On my own view, peace cannot come if there is no justice. If there is a justice, everything will be peaceful. An economical empowerment of the whole societies, because men, as children, women, they need food, the children. The people are fighting because there is injustice. And after peace, it will come prosperity.
Well, thank you. And thank you very much for taking the time to speak with us. Your story is a very amazing story, and I'm very thankful that we have the opportunity to share it, or for me to hear it and to share it with the individuals that will be watching online as well. If you'd like the opportunity to learn a little bit more about the Institute for Women, Peace and Security or the work of Dr. Hawa Abdi, please visit our website at giwps.georgetown.edu.